Welcome to Career Insights. The Career Insight series features local industry professionals engaged in conversation with students and recent graduates about career planning and job opportunities in Polk County, Florida.
My name is Laura Webster. I am an Academy coach at the Polk County Public Schools Workforce Education District Office, and I am joined by my colleague, Tamara Fields. Tamara, do you want to introduce yourself?
My name is Tamara Fields. I'm also a District Academy coach, and Laura and I will be on all throughout the call. We'll be kind of tag teaming and doing introductions between each speaker. So thank you all for coming today, and I'm excited to see what we have to offer here.
Hi, good morning, everyone. I'm here in the class right now. I just finished a class this morning. Physical therapy is a really exciting career, I feel. It's really exciting to be doing it, especially in Florida, where we have a lot of our adults getting older and needing a lot of help in their daily life. It is a pretty diverse field where you can do anything from working with kids inside of a school setting to working in an outpatient clinic with just anybody in your general area that's having any kind of orthopedic problems, concerns, shoulder pain, knee pain, to more complex patients that have maybe had a significant life-changing event like a significant diagnosis like multiple sclerosis or a stroke. And now they're having to learn how to get around their life and do their everyday activities without as much strength or stability or maybe a lot of pain. And you get to kind of go in and help them, aid them in their process of healing or in their process of learning what they can do in their day-to-day lives now to make their life as fulfilling as possible. We also have therapists that specialize in certain parts of the body, maybe work just on the hands so that people can go back to whatever activity they were doing before they've injured their hand or had some kind of event that caused problems in that area. We even have people that end up going into specialty programs and working with animals and working with maybe children, learning their balance and coordination with horses. That's a subspecialty. To people that work with athletes and are helping them along with athletic trainers, and people that work with performers, such as, at Cirque du Soleil, they have physical therapists out back to help them in between their performances to make sure that they're pain-free and able to perform and stay doing their personal job. So I find it to be very rewarding and very diverse. In order to do physical therapy assistant program here at Polk State, you must first just be admitted to the college, as she had mentioned before. If you've never attended Polk State, you have to be admitted to it prior to trying to enter into the PTA program. All of the documents have to be into the registrar's office before even applying, and it can take up to 8 weeks. All these steps, if you're interested, are on the Polk State website under the Physical Therapy Assistant Program. We also have a GPA requirement of at least a cumulative GPA of 2.5 or above on the 4.0 scale. And you have to have some prerequisite courses, college composition, anatomy and physiology, as well as general psych. But every year those can change. So you want to look on the website and make sure to see if anything has been updated as things, change. And you need to make sure that you have a C or better in all your courses in order to complete the degree here. The prospective students also need to do something that's a little bit different than some of the other fields. You have to volunteer or observe for at least 50 hours in 3 different physical therapy locations, inpatient and outpatient. As I discussed, there were so many: in the hospital, in a nursing home, in a school setting, in a home. And you need to go to at least 3 different kinds of settings and get those hours. So some people end up signing up as a volunteer and then going in and doing volunteer hours, helping and learning as much as they can, so that you really have an idea of physical therapy assistant and what exactly you're interested in specifically. And then you have to submit that application. Normally it's by February 15th of each year, and you between January 15th and February 15th, but those seem to be changing every year. So just make sure that you're looking on the website and you're trying to get all of your requirements in before that application period. For our class size each year, it's also very competitive since we only take a cohort of 24 students for each fall semester. They have to have all of those different prerequisites in order to do it. Normally speaking, when you are done with the program, you have to go and do some clinical internships. So when you're near the end of the program, in your second year, you'll be going to different facilities to work underneath a physical therapist to make sure that you're ready and you have those extensive hands-on skills in addition to all of your skills you'll get in the lab so that you can best work with whatever population you're interested in. This is also a really good time to try a couple settings. So maybe doing one rotation where you're in a hospital or in a skilled nursing facility working with elderly that are rehabbing from a massive surgery in order to get them home, or working in a hospital with people that were just under surgery or just injured to try to get them back to their house, as well as working in a second setting, such as a school system or a specialized place or an orthopedic system or an outpatient place where you're seeing those more mobile patients that are just trying to get a better day-to-day life for them instead of having something quite as catastrophic. So it's really interesting to get those hands-on skills and be able to work directly with a clinician that's treating patients for the 40 hours a week. We have a student here now, so I'm going to have her step in and talk about what she likes best about the PTA program. This is Anicia.
Hi, I am Anicia. I'm currently a senior in the PTA program, finishing my third clinical rotation, and surprisingly, I actually have Dr. Lovely as my CI, which I'm getting great experience from. We mostly see geriatric patients for hip or lumbar. She's also a pelvic therapist, so I get to see more hands-on on that. And it's very rewarding when a patient come in and they have pain, and the next day they come and they tell you, "Oh, that pain just decreased. Like I feel so much better." It's very rewarding to see they're progressing that way. So I love it.
She just mentioned one of the other subspecialties, which is pelvic health. We could just go on and on about all the different subspecialties you can get into. But in that particular case, we're working with people specifically maybe during pregnancy with some complications of pain or limitations after pregnancy when they're in what we call the fourth trimester and they're having a lot of complications then. Or maybe somebody who's had cancer or different kind of diseases in any of their, reproductive organs where they're having some complications, whether it be with their bowel or their bladder or other issues. So we can really focus in on making them enjoy those aspects of their life. I'm going to try to switch over then now to the gym area so that hopefully you can see a little bit of part of our lab that's cleared out at the moment. So let me see if I can walk you over there. So I don't know how well you guys can see, but in here we have a lot of our equipment. So we have all these tables that can go high and low to help aid you in treating patients, make sure they're the right height for everybody. We have different machines over here for ultrasound. Instead of the ultrasound that looks at what's inside your body, this can give waves inside of your body to help with pain or inflammation. We also have electrical stimulation, which is a treatment we give people, especially in outpatient, with some hot packs and some ice to make them feel better after they've had some pain or getting stretched. We have lots of equipment like walkers and canes and crutches, as we have to treat people using these and also teach them how to use them properly if they have a new injury. We have over here different kinds of wheelchairs and different kinds of devices. And of course, all the fun stuff you would see when you're working with people that are working on strengthening, as you see the therapy balls, and we have the BOSU and weights and muscle trainers and different things to get people back into feeling in their tip-top shape. We are eager to have more of you guys come and join us. So let us know if you're interested. Go onto the website, look at all the other requirements, and have fun taking some observation hours and helping and volunteering in our community. Thank you.
So that takes us to our next presenter, which is occupational therapy. And that is going to be Anjali.
Well, welcome everyone. So I am not on campus yet. I am traveling soon because there's a lab exam. So that's why I'm not on campus yet. But what you just saw from Dr. Lovely is also the OTA lab. One classroom that you didn't get to see was simulated hospital bed, bathroom, kitchen, laundry. And I'll get into that in a second, why we would have a washer dryer in our classroom and a simulated handicap accessible bathroom. The reason why is because in the rehab family, we have physical therapy, occupational therapy, and speech therapy. Occupational therapy, you have to think about the word occupation. Occupation is anything that occupies your time that is of value to you, okay? So after an injury, we may not be able to tie our shoes because our hands got hurt, right? Or we may not be able to dress ourselves because we had a stroke and we can't use our dominant arm. So occupational therapy, we are the therapists that are known to be creative with our gadgets, and we come up with gadgets that help you do those self-care tasks that we call activities of daily living. So that is why it's called occupational therapy. So one of the most common questions is, what is the difference? If you are interested in the rehab arena, what is the difference between OT and PT? That is the number one question I receive. And I am the OTA director, by the way. So I have received quite a few of these questions. And we work very closely together. So I can give you a case example. Usually I ask you to volunteer a diagnosis, but I'll just make one up. So if you were to give me the diagnosis of a child who's 8 years old, and has cerebral palsy, okay? So the physical therapist and I would be working on the patient at the same time, but maybe different sessions, but the same time frame. Physical therapy would be working on motor skills, gross motor, walking, balance, if there's any pain, strategies for making sure the transfers are safe. So musculoskeletal specialists are what physical therapists are. Occupational therapists will work also on those self-care skills, such as, can they feed themselves independently? Do they need an adapted spoon or a fork for eating? Parents will come to us and they'll be very frustrated because meal times are difficult, and that's a very big priority in their family life. And so we need to be able to listen and have compassion. So psychology is a big part of our profession as well. So we use the psychosocial lens in all that we do in rehab. So although rehab specialists work very closely together, we also have our different areas of specialty. So if you are interested in psychology and you are interested in rehab, I would strongly encourage occupational therapy. A lot of people don't know what it is. We're the best kept secret in healthcare, I think, but it's definitely a very innovative, diverse, like Dr. Lovely said, an exciting field. We work in similar settings as physical therapy, such as nursing homes, home care, hospitals, school systems, outpatient therapy, inpatient hospital. So we work with all injuries, all conditions, and we focus on the occupations of life. So we can teach you how to dance. We can teach you how to get back into your leisure and preferred activities, gardening, things that really mean something to you. If you're a 75-year-old woman and you really don't want to do exercises, but you're more motivated to use your fingers for gardening or knitting. I've done gardening and knitting with my patients before as well. Baking cookies, whatever it takes to make you use your muscles in a fun way. I'm going to share my screen now. And I wanted to let you all know that Polk State, we had a healthcare pathways initiative a couple years ago, and all of us directors and clinical coordinators, we came together with our academic deans and we created a pathway for you. So whatever you're considering in healthcare, if you go to our websites or if you inquire with the directors, you should have access to a program map. And I'm going to show you the OTA program map. It's located on our website under program information. And when you click on program information, you'll see a box that says program map. See here, you see program map, and this is the OTA page. And this is under program information. So it says it's a 74-hour, it's a 2-year program, 24 seats, competitive limited access. We have 2 spots for veterans and 2 spots for linkage. So I want to let you know that we do have very secure community partners, and we admit every September. Program begins in January. So here I'm going to click on the OTA program map, and then you'll see here that it's literally a map. So before you even are admitted, this first box is what we would like for you to take. So in here you have your required prerequisites where you'll need a 2.5 or higher for English, psychology, and anatomy and physiology 1 with lab. And then if you can take A&P 2 ahead of time, that would be fantastic. And then you apply through the college first, and you apply to the program on September 1st. And this is your curriculum. So it breaks it down term by term. It tells you how many credits. So if you're looking into financial aid, you'll have that information there as well. And that's it. So it's 1 or 2 small little boxes that are an entire roadmap for your education. Our program is great. I love being an occupational therapist. I've been an OT for 11 years. I love academics. That's my passion. And we are definitely in demand because baby boomers are aging, so they need rehab, right? So we are specialized in aging adults and making sure adults can age in place. So job market is always good for us. In Florida, it's competitive because there's so many OT and OTA programs. If you're willing to travel, if you're willing to wait for that perfect job, you will get it. But I encourage you to be patient because it's a very competitive field and lots of qualified people. So we want to produce the cream of the crop. Our pass rates are very high for the NPCOT exam, the national board exam that you take upon completion of the program. And our placement rates are very high. So I am biased, but I do believe this is a strong program. Tuition is very low compared to the rest of the state. I agree with Mr. Ferrier, it's $11,000 or less. And we do have financial aid. If you're a Polk State resident or Polk County resident, you could qualify through Career Source Polk, which is a scholarship. So I encourage you to look into that as you're making your decision to see if furthering your education at Polk State is for you. And if you have any questions for me specifically, I encourage you to email me because I do need to leave to get to campus pretty soon. So if you go on our website, you'll see my email information and you email me any questions. We're not doing tours right now because of COVID, but I'm happy to set up a teleconference and answer any of your questions. Thank you so much.